Living Kidney Donor Education. Welcome. Thank you for considering living donation. University Transplant Center is a partnership between University Health System and UT Health San Antonio. Inpatient units and transplant clinic are conveniently located at University Hospital on Medical Drive. We are national leaders in the field of transplantation with 50 years of kidney transplant experience. We are recognized as a center of excellence. Positive aspects of living donation. You are among a unique group of people because you are willing to donate a kidney to save a life. The surgery can be scheduled at a convenient time for both the donor and the recipient. Living donor kidney transplants free up more space on the waiting list for those that do not have a living donor. Living donors can receive paid leave for donation if they are state or federal employees. Organ Donor Leave Act, H.R. 457, 106th Congress. This law allows living donors up to 30 days of paid leave if federal or state employee. Please follow the link on the slide for additional information. Who can be a donor? A donor must volunteer and be willing to complete all required testing, be at least 21 years old, in excellent physical and mental health, be able to understand the risks and possible complications, be in a stable life situation with established social support. Making an informed decision. Your consent to become a living kidney donor is completely voluntary, and you are willing to donate, and your decision to donate is made without inducement or coercion. Living donors cannot be paid for donation. It is a federal crime. Living donation is a treatment option and will not necessarily cure the recipient's underlying cause of kidney failure. The potential recipient might have risk factors for increased morbidity or mortality that are not disclosed to me. Treatment alternatives for the recipient include dialysis, deceased donation, and/or medical management by their physician. A deceased donor kidney might become available for the recipient before my evaluation is completed or before the transplant occurs. You have the right to delay or stop the donation process or surgery at any time. Your decision will be kept confidential. University Transplant Center may refuse a potential donor. You can be evaluated at another program with different selection criteria. Psychosocial or financial risks. Financial stressors, testing, surgery, and medical care related to the donation is covered by the recipient's insurance. Travel, personal expenses, time off work, housing costs, child care, household bills are not covered. Donors need to plan their finances in advance. National Living Donor Assistance Center, or NALDAC, may be available to provide financial assistance with expenses associated with living organ donation. After surgery, you may experience emotional distress, psychiatric disturbance, depression, anxiety, guilt, resentment, disappointment, or grief if recipient experiences recurrent disease or in the event of their death, altered body image due to the scars. Donors will have access to a transplant social worker to assist in addressing issues before, during, and after donation. Impact on donor lifestyle, recovery time, pregnancy. Avoid direct impact on the area of your kidney. Need for lifelong follow-up at the living donor's expense. Potential for loss of employment or income. Negative impact on the ability to obtain or maintain future employment, afford health, disability, and/or life insurance. Future health problems experienced by living donors after donation may not be covered by the recipient's insurance. Donor evaluation. Consult with a surgeon, nephrologist, nurse coordinator, dietitian, social work, independent donor advocate, and/or a psychologist or psychiatrist if recommended by the transplant team. Blood and urine tests, chest x-ray, EKG, and cardiac testing if needed. CT scan to view the kidneys and blood vessel supply. Age-appropriate cancer screenings. Any additional tests the doctor feels is necessary. All donors are encouraged to have a visit with their primary care provider, or PCP, within the prior year to establish care for future checkups after donation. Donor evaluation continued. Independent Living Donor Advocate, or ILDA. This team member is responsible for promoting the best interest of and acts as advocate for the donor, as well as assists the donor to understand consent, evaluation, surgery, medical and psychosocial risks, and the importance of post-donation follow-up. The ILDA does not work with the recipients. Social work consult to assess your mental health, ability to understand information, and make informed decisions, daily life circumstances, and assure that donation is free from inducement, pressure, and coercion. Possible risks during evaluation: allergic reaction to contrast, discovery of reportable infections, serious medical conditions, genetic findings unknown to donor, certain abnormalities that will require more testing at the donor's expense, or create the need for unexpected decisions on the part of the transplant team. If test results reveal a potential risk for disease transmission, the donor will be required to provide consent before a physician can discuss the risks with the recipient. If a donor does not consent, the evaluation for donation and/or living donor surgery may be canceled. Matching donors with transplant candidates. Blood tests will be done to check for blood type compatibility. If blood types don't match, additional points are given when on the OPTN, Kidney Paired Donation Pilot Project, or KPD-PP, based on blood type of donor and recipient. Blood tests will also check for antibodies that the recipient may have against your blood. This is called Calculated Panel Reactive Antibodies, or CPRA. Additional points are given on OPTN, KPD-PP, for CPRA using a sliding scale. Blood type compatibility chart shows the recipient blood type is O, the donor's blood type needs to be O. If the recipient's blood type is A, the donor's blood type can be A or O. If the recipient's blood type is B, the donor's blood type can be B or O. And if the recipient's blood type is AB, the donor's blood type can be A, B, AB, or O. Living donor options. Directed donation is the most common type. A donor may be a family member, friend, coworker, church member, or neighbor. The Kidney Paired Donation Pilot Program, or KPD-PP, Paired Donor Exchange, is an option if you are not compatible with your intended recipient. Altruistic or non-directed donor, NDD, does not know the specific person that will receive the transplant. NDD can participate in one or multiple KPD, donate directly to the waitlist, or be a bridge donor. Matching requirements for OPTN KPD-PP. Donor and candidate are matched based on donor blood type and a review of antigens. They will be matched to maximize the number of matched pairs. Children and high PRA are considered. Have choices that can be used to identify match opportunities, willingness to travel, and bridge donor, but cannot choose whom they match. Have the right to withdraw and/or decline any match offered at any time for any reason. The candidate's transplant hospital determines if the matched donor kidney is appropriate for their recipient. The computer finds and displays one solution for each match run. Matches will receive additional points when the transplant hospital registers donor and recipient. Kidney swap, matching donors with transplant candidates. If you have a donor number 1 who is not a match to their recipient number 1, and then another pair where the donor number 2 is not a match with recipient number 2, we can see if the donor number 1 is a match with recipient number 2, and if the donor number 2 is a match with recipient number 1. That is considered a kidney swap. Waiting for a matched pair. Wait time will vary based on availability and scheduling of donor and candidate, the other pair, number of matched pairs. Donors may need to provide multiple blood samples on numerous occasions for potential matches. Pairs may not have equal outcomes, and unfortunately, many matches are terminated before donation and transplantation. KPD-PP, internal exchange, matching donors with transplant candidates. In this example, it starts with an altruistic donor who gives to recipient number 1, and donor number 1 gives to recipient number 2. Donor number 2 gives to recipient number 3, and donor number 3 becomes a bridge donor. 2- and 3-way matches. Each matched donor recovery must be scheduled to begin within 24 hours of the start of the previous recovery. The donor surgeries and the exchange will begin only after all transplant programs agree to proceed. Donor chains. Each matched donor recovery must be scheduled to begin within 21 days from the date the matched donor's paired candidate receives a transplant. KPD-PP, candidate donor pair, has option to have surgeries begin within 24 hours of one another or refuse the match. Shipping a donor kidney. The following are risks associated with shipping a donor kidney for living donation. Possible delay in kidney function because of transportation time between transplant hospitals. Although this has never happened at UTC, accidental damage or loss of organ during transportation between transplant hospitals. Unexpected events for paired donation. An unexpected event may occur that prevents the paired donor's kidney from being transplanted to the paired candidate. The recipient that does not receive a transplant is identified as an orphan candidate. The remedy for failed exchange does not include any additional priority for the paired candidate on the deceased donor waiting list. Examples of unexpected events. An unexpected issue with the donor kidney is found during or after the surgery. It may be necessary to stop the donor surgery while in the operating room. If the recipient's surgery must be stopped, the donated donor kidney would be assigned to a recipient on the deceased donor waiting list. Bridge donors. A donor who does not have a match identified at the same match run as his paired candidate has the option of being a bridge donor. You can revise the amount of time you are willing to be a bridge donor. Before agreeing to a bridge donation, you will be informed when a chain will end with a bridge donor. You or donor hospital or non-directed donation hospital can request that attempts be stopped at any time, and you can donate to the list. Your medical evaluation may expire, and an updated evaluation prior to donation will be needed. You may need to supply multiple blood samples on separate occasions for new cross matches. Healthcare information. Donor will be asked to sign a release of information. Donor's personal and medical information will be shared with the transplant hospital where the candidate is matched. Every effort will be made to keep donor confidentiality. Paired donor name may appear on matched candidate insurance explanation of benefits. Matched candidate insurance benefits may be different. This information will be provided to the donor. Donors and recipients can meet after the donation if all parties agree to the communication. Selection Committee. Once the required studies and consultations have been completed, the information will be presented, reviewed, and discussed at the Transplant Selection Committee, which consists of the surgeons, nephrologists, transplant coordinators, and the social workers. The committee will make the final determination to approve or decline a living donor. A donor may be evaluated by another transplant program that may have different selection criteria. Before your surgery, stop tobacco and alcohol use 1 month before donation. Women need to stop birth control pill 1 month before donation, or as advised by the transplant team, and utilize 2 forms of contraception, barrier and medical therapy, to avoid pregnancy. Do not take aspirin or NSAIDs such as Advil and Nuprin for 2 weeks before the surgery. Kidney donor surgery. Hand-assisted laparoscopic nephrectomy. The hand-assisted approach is the most common method for surgery. This procedure is performed through 2 small abdominal incisions called ports. The surgeon inserts laparoscopic instruments into these incisions to isolate. A 3 to 4 inch incision is made on the lower abdomen, just large enough to remove the kidney. Risks of donation. Potential risks to living donors may be transient, or short-term, or permanent. Reaction to general anesthesia. Surgical complications can include infection, blood loss, requiring blood transfusion, blood clots, pneumonia, injury to surrounding tissue or other organs, heart attack, stroke, or death. Surgical scars, pain, constipation, bloating, nausea, fatigue, and/or persistent shoulder pain are expected outcomes. Hernia, decreased kidney function, approximately 25 to 35%. Future obesity can lead to hypertension. Kidney organ impairment or failure that may lead to need for dialysis, transplantation, or death. Discharge and follow-up. Donors will typically stay in the hospital 1 to 2 days. Typically resume normal activities in 4 to 6 weeks with lifting restrictions for at least 6 weeks. Not be able to drive for up to 2 weeks. Be seen in the transplant clinic in 7 to 10 days after donation for a follow-up clinic visit. Every transplant center is required to report living donor follow-up data at 6, 12, and 24 months post-donation. Any infectious disease or malignancy pertinent to acute recipient care discovered during the donor's first 2 years of follow-up care will be disclosed to the donor, may be reported to local, state, or federal public health authorities, and will be reported to the recipient transplant center if paired exchange occurred, and the OPTN Improving Patient Safety portal. Live Kidney Donor Transplant Survival Report, release date January 5, 2021. The Living Donor Kidney Transplant Program at University Hospital in San Antonio has exceeded the national average in patient survival. Countless lives have been saved at University Transplant Center since 1973 thanks to generous living donors. Our exceptional survival outcomes is a testament to our evidence-based practices, advanced technologies, and patient-focused safety. Our most recent outcomes above were published on January 5, 2021 by the Scientific Registry of Transplant Recipients. They are based on 1-year survival rates for transplants performed between July 1, 2017 and December 31, 2019. New reports are available every 6 months at srtr.org. Stay healthy. As a living kidney donor, you will get regular medical checkups, not gain an unhealthy amount of weight or become obese. Stay active. Exercise, walk, run, dance, play, move your body, nurture your body, mind, and spirit. Eat a healthy diet, low fat, low sugar, low salt, and avoid medications that could harm or damage your kidney. Some examples are NSAIDs like ibuprofen, Motrin, Aleve, and Advil. Pregnancy after donation. Pregnancy after donation will require close monitoring by the OB/GYN physician because the risk of preeclampsia or gestational hypertension may be increased and the post-donor may be considered a high risk. Preeclampsia is a pregnancy complication characterized by high blood pressure and damage to your kidney. Gestational hypertension is the development of high blood pressure after 20 weeks gestation and defined as blood pressure greater than 140/90. UTC recommends you wait at least a year after donation before becoming pregnant to confirm stable blood pressure and kidney function after donation. Verbal quiz with your coordinator. Why is follow-up so important after donation? What are the required intervals for follow-up with the transplant program? What are common complaints after donation? How long is the recovery process? Stay connected. Join our Facebook closed group, a private community for University Transplant Center living donors and advocates to share their stories, experiences, and to provide peer-to-peer support. Go to facebook.com/groups/UTC Living Donor Champion. We look forward to working with you. Please contact us with any questions at 210-567-5777.